My fellow citizens and residents of St. Kitts-Nevis, as a medical doctor and indeed a former Prime Minister of St. Kitts-Nevis, one who provided political leadership of the Pan-Caribbean Partnership against the HIV/AIDS pandemic in this region, I am deeply committed to effective public health policies and practices. I also know the critical importance of proper public health education and awareness initiatives that promote understanding and transparency and encourage feedback to secure our people's support to accept the government COVID-19 vaccination program. But of equal priority, I have a passion for working with different stakeholders, NGOs, private sector, faith-based and community organizations, and of course opposition parties to achieve the goal of excellence in prevention, testing, teaching, tracking, and a clear rollout vaccination plan. This is needed to encourage wellness, to boost immunity, to promote prevention, and to reduce the spread of diseases. Since last year, 2020, we have encouraged the Harris administration of St. Kitts-Nevis to collaborate with the opposition in the fight against COVID-19. Prime Minister Harris has flatly refused when several doctors and I shared practical advice on how to use the Public Health Act instead of a state of emergency with curfews to balance democratic rights and public health protocols for positive results. Just last week, Thursday, the 18th of February, during the meeting of the National Assembly of our Parliament, while calling on the government to provide a clear vaccination rollout plan to be shared with our citizens, I was rudely interrupted and prevented from doing so. Clearly, the government was failing miserably to communicate its plan to the general public. On such a vital matter, where people must find creative solutions between preserving their lives and maintaining their livelihoods, Prime Minister Harris prefers to operate as a secret society. He withholds critical information rather than functioning like a caring leader who is ultimately committed to the well-being of all. Not only did I invite the government to disclose its vaccination rollout plan, I sought clarification on the storage of the vaccines, while the storage facilities themselves were being prepared, as reported by the Prime Minister Harris. Clarification on the efficacy of the Oxford AstraZeneca vaccine that the government had secured was also sought. Further, I requested information on behalf of the thousands of residents and citizens about the original source of the vaccines. It was also absolutely necessary to have supporting scientific data based on the many associated risks and adverse reactions related to age and pre-existing medical conditions that have been reported in the press. The country still wants to know if this was the same vaccine type for which Prime Minister Harris said, and I quote, he made a down payment of US $800,000 taken from the treasury of St. Kitts-Nevis, end of quote, in December of 2020. Also, a number of questions are being asked. Were the Medical Association, the St. Kitts-Nevis Nurses Associations, other frontline workers in the COVID-19 fight, the workers' unions, etc., were they invited? It is important to get clarity on these issues because I am interacting with hundreds of people who are fearful and anxious about the safety of vaccination and demand urgent but reliable answers. But instead of providing the population with helpful answers, Dr. Harris and his administration have acted in bad faith. They openly refused to cooperate. Up to late Saturday evening, the 20th of February, I did not receive credible answers and clarification on the important information I was seeking. In light of these circumstances, I refused to take the vaccine on Monday, the 22nd day of February, during the photo gallery parade of the government, without knowing whether the entire population would be vaccinated and how soon. As a member of parliament and as leader of the parliamentary opposition, my conscience would not permit me to secure myself at the expense of my people. And so while I support vaccination as a public health good, I totally reject the politics of divisiveness that Prime Minister Harris is promoting, especially during these emotionally tough and economically difficult times. I do believe strongly in vaccine equity, and I want to make sure that the poor and the rich alike, the elderly and the young, the sick and the healthy, all have equal access to the best vaccines affordable to us here in St. Kitts-Nevis. Any government vaccination program must be fair and balanced. All responsible leaders should know that information about the vaccination type and process must be honest, it must be straightforward and scientifically sound. This is not just good public health practice. It is the right and the just approach to good governance here in our country. I will continue to encourage our people to adhere to all the healthcare COVID-19 protocols needed to stay safe, wise, and positive. Rest assured, my fellow citizens and residents, that we together shall defeat this COVID-19 pandemic with our peace of mind intact and our faith strengthened and renewed. Again, as I end, I emphasize that as a physician, I strongly support vaccination, and we of the parliamentary opposition strongly support vaccination. But we resist the divisive attitude and defects in the Harris administration vaccination rollout plan. It please you. Thank you.